Good morning, everyone. This is week 9. My name is Ying Mei Hua. We'll keep discussing remaining part of informations together today. Before we go through the week 9's new information, we go through some brief revision for week 8 concept through the multiple choice. So let's have a look if we can have a bit of fun together. Now, first slide, let's have a look. 3 statements. And try indicate it right or wrong for each of the following statements with simple explanations. Lurking summer heat warms only happens in summer. This category of wimping had the names involved in terms of summer. Are they only happening in summer? It's no. Attacks in summer, and the pathogens will be incubated until autumn and winter will come out. Thank you. So this is no. It's not happening in summer, and it's only happened in the season after the summer. So happen in autumn and winter. Thank you. Second is lurking summer heat pathogen can cause illness without external pathogenic attack. So does lurking summer heat warms require the invitation or not? Okay, they require the invitation. So this is wrong because of here. So they require the invitations and to allow the incubated summer heat and incubate internally comes to the surface. That does need invitations. So need the trigger pathogen from externally in autumn and winter. Thank you. Number 3, the lurking summer heat is similar to the summer heat, which features mainly excessive young in nature clinically. So based on the angle of this statement, is that correct or not? It is true. So when it shows clinical manifestations, they have exuberant of heat related with summer season. Even the lurking summer heat happen in autumn and winter, but this internal heat is going to indicate a lot of clinical manifestations related with high temperatures. So this is the correct one. So then why this name of lurking summer heat worms using summer heat? Otherwise, you just can say lurking heat worms. So they have lots of similarities regarding to excessive young conditions for both lurking summer heat worms and summer heat worms. So these basic 2 pathogens is going to generate similar internal heat regarding to internal excessive heat. Thank you, Rebecca. Okay, any questions for first slides? Okay, if there's no questions, we go to second slide. If any of you find this too fast or any concern or questions, you can raise issues anytime, okay? Thank you. Now, second slide, there are 3 statements again. Number 4, qi dynamic is easily affected by damp cold or damp heat pathogen internally. Thank you, because they all involve the damp pathogens. Damp is a major causes for disorder of qi dynamics. So this statement is correct. Thank you very much. So every time when you see clients have very greasy tongue coating, no matter it is a white color or yellow color or turbidity, they always correlate with bloating, discomfort, distensions involved, or burpings or far. Number 5, both of the summer damp heat worms, lurking summer heat worms manifest with internal damp heat symptoms and signs. Now, summer damp and heat, definitely is going to have internal damp heat, yes? incubated lurking, why they can lurking, and why they happened in summer for the pathogen attack, why the only comes out in autumn and winter and difficult to resolve. They also have damp involved. Even in name of category does not mention any damp, but it does have internal damp heat. So overall, the internal damp heat symptom signs does involve both of summer damp heat worms as well as lurking summer heat worms clinically. So this is correct. Okay, any question for this statement? All right, number 6. The summer damp heat worms only occurs in summer, while the lurking summer heat worms can happen in summer, autumn, and winter. Okay, because we add an additional unnecessary term here, this makes the whole statement become improper. So this is incorrect. Thank you. Now, next one. Number 3rd slide, number 7. Both of the spring worms and the lurking summer heat worms are caused by a lurking pathogen, or should be related with lurking pathogens. So all lurking pathogens should be related with lurking pathogens. One requires trigger, the other one does not require trigger. They're all related lurking pathogens. And spring worms does not necessarily require a trigger, but lurking summer heat worms does require the invitations. But they're all caused by lurking pathogens regarding to severe clinical manifestations. So this wording should be corrected. Reconstructed are related with that. Number 8. The spring worms often initiated with exuberant fever in chi level, while lurking summer heat worms with noticeable external wheeze symptoms and signs combined with internal chi and in-level disorders. Chi or in-level disorders. So choose and so first half of sentence is correct. So summer heat worms often initiated with exuberant fever in the chi level. This is correct. Second part, lurking summer heat worms often with noticeable external wheeze symptom, which is also correct, combined with internal, from here something's wrong, with internal heat and a damp cause of chi disorders. So in levels is not very common to start with, but chi level disorder due to damp and cold obstruction internally is quite commonly correlated. So this overall is incorrect, only partially correct. So here just exercise for some concept for the exam is much more easy, straightforward. Here just make it tricky here. Spring worms, yes, because here had abbreviations here. Thank you, sorry. That's why I put at this beginning. So spring worms, yes, thank you. SW is a spring worms. Thank you very much. And here's a lurking summer heat worms. Here's a lurking summer heat worms. So same for our assignment. If we're using abbreviations, we need to have some example to present it beforehand and then using abbreviations later. Thank you. Now number 8. Both of the spring worms and lurking summer heat worms affected mainly by relevant seasonal damp heat pathogen. False, because there's no damp involved into the spring worms at all, and both of these kind of specific Wenbing disease does not happen within their original season. So spring worms is a winter pathogen attacked and incubated internally, comes out in the spring. Lurking summer heat worms is a summer pathogens, damp heat pathogens invaded and incubated internally, comes on in winter and autumn. So there's nothing related with that at all. So one is seasonal, is not correct. Second is not both of them involved with damp heat, only lurking summer heat. Okay, any questions for these slides? All right, I assume everybody's fine. Okay, next slide, number 10. The spring worms easily has yin injury or yin disorder, while the lurking summer heat worms only has qi dynamic disorder due to damp heat constrain the qi. So only troubles here from here. They make it absolutely, so become wrong. So if we remove this one, everything else is still acceptable because summer heat, the lurking summer heat involve both damp heat. Heat is exuberant, very easy injury yin. Damp is a constrained qi. So because it's only making it absolutely only qi dynamic disorder, and this become whole statement is improper or incorrect one. Thank you, Lucy. Now number 11, the damp worms has damp more than the heat symptoms and signs initially, compared with lurking summer heat worms, and has equal internal damp and the heat. So not damp, this should be damp. Or heat more than the damp symptom signs. Based on clinical manifestation, this is correct. Because lurking summer heat worms have much more severe high temperatures and much more fast progressions, but damp worms have very slow onset, very slow progressions, and they do not have a severe clinical manifestation in general. Number 12, both of the damp worms and lurking summer heat worms has a long-lasting duration. These damp and heat pathogens are difficult to resolve in short term. Due to they all have a damp involved, these will usually involved into the long lasting duration and difficult to resolve in short term as a kind of result. So dampness is something lovers all the time and can causing pleasant enjoyment and causing a lot of annoying and troubling for our qi dynamics. Okay, any question for these slides? Now we keep going for the next slide 6. 13. Both wind worms and lurking summer heat worms can happen in windy weather. Wind is very, very common trigger points, trigger causes. So that means they have possible invitation for lurking summer heat. And wind worms also involved with wind and heat. So windy weather is very common season for virus to coming out to play with us, causing illness. So overall, this is correct. Thank you. Now, number 14, both of the wind worms and lurking summer heat worms can have common cold symptom signs initially. If they have invitation triggered, yes, they can have both and common cold symptom signs. But if you can only have, that'd be wrong. But this, talking about general terms, can have common cold symptom signs. This is correct for both of that. If it says can only have common cold, will be not correct. So here says have, can have common cold. So of course, they lurking summer heat can trigger by wind cold attack from exterior. So exterior shows common cold symptoms, internally shows damp heat. So they can have. So that's correct in this way. So I can writing with my left hand. I can also writing with my right hand. If you say I can only writing with my left hand, which is incorrect because I'm right-handed. Does that make sense? Now 15. The lurking summer heat pathogen can be transformed into dry heat internally if there is insufficient yang qi in the body. The lurking summer heat pathogen can be transformed into dry heat internally if there's insufficient yang qi. Yes or no? False. They have to have sufficient yang qi, and then lurking summer heat pathogen can transform into dry heat. So this is incorrect one. Have to have, oh, sufficient, you're right, it's correct one. Only have sufficient one, it's correct one. If it's insufficient, you turn to the different natures of pathogens. When the body have a lot of heat, so a lot of yang qis, and this damp heat can turn into dry heat easily. It's the correct one, sorry. It's my fault, misleading. Okay, now any question for this slide? Make myself confused. So when people have sufficient yang qi, that means very easy if you're hot. So if you are very hot, you're very easy and causing the dampness become dryness or heat. But if you have insufficient yang qi, you're very easy become a kind of damp cold over time. Yes, when people have lots of yang qi, they're very easy feel thirsty and very easy feel hot. But for people have insufficient yang qi, usually they feel what? Opposite. They have no desire to drink, very easy feel cold. So that's a different one based on constitution. So when the constitution have a lot of yang qi and summer damp heat, very easy turn to the dry heat. Number 16, the unresolved summer heat or unresolved summer damp heat pathogen can become lurking summer heat pathogen. The reason there's a lurking summer heat pathogen because there's unresolved summer heat or damp summer heat attacked in summer, and then through the incubations, and then they grown up kind of strong with invitations, and they come in trouble. So here is a can. So this is correct statement overall. Now, number 17, internal damp heat accumulation pattern and could be treated same as the CM diagnosis. It can be treated the same if the CM diagnosis is the same, no matter the season. So we have to emphasize this one again and again and again. If that does happen in summer or happening in different season, we just need, based on syndrome differentiations, maybe through the modification formula, added specific yin supply in the summer season, added more qi regulating ingredients in cold seasons accordingly. But the differential diagnosis pattern based on CM differential diagnosis is vital to lead us for construct proper formulas. Number 18, clear heat, eliminate dampness, strengthen middle gel function, and enhance qi activity are the main principles for treating the lurking summer heat or treating lurking summer heat warmth. So this is basically reviewed all the principle. We need clear the heat, manage the damp, restored function middle burner, and also it makes sure the qi activity has been restored, and all the damp heat, lurking summer heat, dampness can be resolved, symptoms can be managed. Thank you. And number 19, the strong diuretics, purgatives, heavy yin tonify, and yang warming herbs should not be applied to treating the lurking summer heat warms and damp warms in the early stage. The reason is because a lot of diuretic very easy causing qi and body fluid injury, and strong purgative can damage the qi and causing body fluid leakage, and heavy yin tonify can further constrain the qi circulations, and excessive yang warming herbs can cause dehydration and supporting heat pathogens internally. So do be careful using these very, very strong herbs. But one thing I need to ask you, does strong warming herbs or can strong warming herbs use for damp warm conditions or not? If you're using strong warming herbs, and damp heat will turn to the what? Dry heat. So that's why it still could not be used. We're using something gentle, such as 青蒿, 竹茹, this kind of gentle herbs, 藿香, to vent the damp and the heat to surface in the early stage. Here mentioned in the early stage, very important here. Thank you very much. Now, number 20. If the body has constitutional yang deficiency, the internal damp heat passage can be transformed. Oh, too much error for the grammar. Into more damp or even damp coldness. So this opposite statement compared with previous one. If you have sufficient yang qi, you're going to turn to the dry heat. If you have insufficient yang qi, you turn to more damp or even damp cold conditions. Thank you. Number 21. 蒿芩清胆汤. 蒿芩黄芩. 蒿芩清胆汤 can resolve damp heat accumulation, cause Shaoyang disorder or malaria-like symptoms and signs with poor qi activity in the middle jiao. Okay, we just mentioned it. 青蒿is a 青蒿黄芩, very good herbal pair, which replace the 柴胡黄芩presented in the Sanghan Lun. So this is a very good herbal pair to manage Shaoyang disorder, used for Wenbing, damp heat passage and cause of issues. Thank you. Next slide, 22. 子时导致汤 can manage damp heat retention in the middle jiao with food stagnation syndrome. And if you cannot remember composition, it's very easy thinking about how do we interpret name. 子时 is very strong qi regulating herbs, also descending qi downwards. Yes, 导致 Dao is guiding obstructions downwards, so must have some productive in nature. So both of these interpretations can help you understanding. They can deal with food stagnation, related qi obstructions in Wenbing. So this is correct based on this way. If you could understand the name or can interpret name of this formula here, or understand name of formula. Now number 23, both of the wind worms and lurking summer heat worms have noticeable external disorder initially. This is true. So one is definitely, the other one needs invitation. So both of them correctly. Number 24. And this specific skin disorder looks like little bubble transparency. Miliaria alba could present it in both damp worms and lurking some heat worms conditions. There looks a little blister, but with little turbid liquid good, because the body is not able to have proper perspiration. This will come out, especially in hot, damp environment, or for people not able to perspiration and due to insufficient DD function of the lung. 25. The lurking summer heat worms has more severe symptoms and signs than windworms in winter due to incubated mingled damp heat pathogens. Both of these conditions can happen in winter. The different way to differentiate them is windworms have very clear noticeable and wheel level conditions, but lurking summer heat, while they have noticeable wheel level conditions, they also and have internal damp heat and simultaneously more severe clinical transmissions. So this is a correct one. Anything incubated make everything much more complicated, especially when mingled damp and heat comes together. 26. The damp pathogen can affect Sanjiao's qi dynamics, so looking after Sanjiao's qi activity are essential for treating both damp worms and lurking summer heat worms. So moving the qi, regular qi activity is very, very essential. No matter this kind of qi circulation, middle jiao or triple burner, but you have to make sure energy is flowing. So if you feel sleepy, unnecessary body weight gain, and always feel heavy of the body. That means your qi dynamic in the middle jiao has been very, very badly constrained due to too much of damp. So let the body moving, start moving with gentle motion, stretch, a little bit breathing, a bit walking and then jogging. You'll find you'll have much better qi performance, much better tone of muscles, and less floppy soft tissues. And 27, Shaoyang disorder is one of the common patterns presented in both damp worms and lurking summer heat worms. Why Shaoyang disorder could be affected by this kind of wound is due to both of them have damp pathogens internally. The damp constrain the qi circulation. Shaoyang, we learned in the Sanghan, is a pivot or represent the yang qis rising. If there's too much of damp, like this morning, and there's so many mist, heavy fog, can sun ray break through easily of this kind of heavy fog? It requires a lot of effort. Same for Shaoyang. If the body have lots of damp and they cannot perform proper qi rising and to help circulation, at the same time they cannot adjust the qi and transmission between Taiyang to Yangming, or from a Yang division to the Yin division. So this is correct one as well. Now the last slide, 28. In general, if damp more than heat in damp worms, the damp worms pattern will have more severe qi disorder than the lurking summer heat worms pattern. So be careful here. If damp more than heat, and then have more severe qi disorder. So is that correct or not? So this basically linked with previous statement. Number 29. The lurking summer heat worms heat usually more than dampness, so it has more noticeable severe fever or heat-related symptoms signs. Or in another way, they have much more fast transmissions. They have more fast transmissions. When you have heat is more dominant than a damp, they have more severe fever and more fast transmissions. So these lurking summer heat worms have much more severe conditions than the damp worms or than the wind worms. The reason is due to the heat is related to summer heat. Like a sun is very, very strong and very, very powerful and shows exuberant heat internally, as was a damp. Number 30, the last one, 达原影. So when you're talking about memory sources, 达原影, for treating memory source disorder due to damp heat in the damp worms, is more warmer than 蒿芹清胆汤. 蒿芹清胆. Oh my God, what's happening? 蒿芹清胆汤 that treat the Shaoyang disorder due to damp heat in the lurking summer heat worms. So he asks you, does 达原饮 is warmer than 蒿芹清胆汤? And then you need to compare, does the damp worms is more warmer than the lurking summer heat worms or not? If the damp worms is relatively cooler than lurking summer heat worms, yes, 达原饮 should be warmer in nature. So here, you may do not remember exact composition, you just need to compare which one shows more warmer clinical manifestations for these two. Because they all deal with Shaoyang or malaria-like conditions. Which one's warmer? Is the damp worms more warmer based on the clinical manifestations, or lurking summer heat worms more warmer based on their clinical manifestations? Which one's more warmer? Lurking summer heat worms. So if both of these dealing with Shaoyang disorder or dealing with memory source disorder, similar like malaria-related conditions, so that means which formula should be warmer? So warm one deals with cooler condition, cooler one deals with warmer conditions, yes? So that means this formula will be warmer, and then the 好晴清淡汤. So this is warmer than 好晴清淡汤. That means the whole statement is the correct one. Sorry, make this complication here. Just a review tells you both damp worms and lurking summer heat worms could have some symptoms related with malaria-like conditions, also or Shaoyang disorder, but the choosing formula is different because in the damp worms, damp is more dominated, causing severe qi dynamic disorder. So a lot of aromatic warming herbs involved to try to resolve, transform the damp, and also clear the heat internally, regulate the qi. But for the lurking summer heat worms, heat is more severe, more dominant, strong than the damp, relatively, because related with summer. So relatively, their formula have some ingredients clear the summer heat, as well as transform the damp and regulate the qi. Okay, now any questions, or does it help at all to review some information we learned from last week? Okay. Thank you. I know Wenbing, the category of seminal category of Wenbing is very easy to get confusing when they come to the clinical manifestations. And in order to able to identify the difference for each of these categories, you need to focus on their clinical manifestations and the causes of pathogens, as well as which season they comes out. Is that heat dominated, damp dominated, or both are equally simultaneous dominated, or only have heat without the damp, or only specific happened in the different seasons after incubation, or only happen in the same season, or required invitations, or do not require invitations. So this can help you differentiate different categories within Wenbing range, theoretically. Based on clinical practice, once the differential diagnosis is the same, the treatment will be exactly the same, or could be exactly the same. Could be, not would be. So like here, damp worms and lurking summer heat worms, they all have similar conditions like alternative chills and fever. But one is damp worms. Damp is more than worms. We're using 大原因. Second is heat is more than damp, and happen in winter and autumn. And then we're using what? Using 好晴清淡汤. So this one have slightly differently based on some construction of ingredients. Now, let's have a look what we are going to learn today. Is anything more challenged today or easier? Number 6 category of the Wenbing is 秋燥 or autumn dryness worms. Autumn dryness worms is most simple and easy category of Wenbing in general, because based on informations and based on the number of slides, this is most less one, and the most less counted numbers, and clinical manifestation is much more mild. So let's have a look. Overview of the autumn dryness worms. Usually, autumn dryness worms only happen in a specific season, autumn. If they happen in a different season, they cannot be defined as autumn dryness. In the early autumn, usually you're going to have dry heat pathogen involved, because part of the summer heat still has not been cleaned, relieved yet. So you can have dry heat pathogens. And in the late autumn, this kind of heat started diminished due to descending of the yang qi in the season of late autumn. You could have possible cold dryness involved. But for the autumn dryness worms, we mainly focus more on the warm dryness pathogen involved clinical manifestations. Due to both warm and dry pathogen are young in nature, so they have they very easily have quick onset and very easily to injure body fluid. And due to level of the heat, it's not heat, it's only warm, so they do not have serious clinical manifestations. So very less big temperatures and much more easier to control in general, except whooping coughs. So it's except allergies, except whooping coughs. So temperature itself very easy to manage. The other related symptoms is not very easy to treat, depends what conditions involved. Most common related biomedical disorders such as upper respiratory infections, acute bronchitis, etc. Sometimes they do involve into some allergy-related conditions and mingle together or triggered by bacterial infections or virus infections as well. So as we mentioned in the early autumns, and the heat and dry is a major pathogens due to influence of the summer, and the later autumns, and due to the yang qi has been descending downwards, and usually cold dryness comes out as a kind of dominant pathogens. Compare these two pathogens, dry heat, both are yang in nature, had more severe injury, but cold dryness, one is yin, one is yang, have less body fluid injuries. So these have much more less temperatures and less body fluid damage. So one is happening early autumn, one is happening in the later autumns. The warming dryness cause of autumn dryness syndromes have clinical manifestations and similar like upper respiratory infections initially. And dry heat attacks the lung and wheel, leading to the injury of the body fluid. People have a lot of desire to drink, a lot of thirsty, and dryness on the throat, on the mouth, and the lips, and even dry on the skin and the nose. And for people who have been affected by dry heat passing the autumn, usually constitutionally they have very skinny body types and very dry skin already, and have insufficient yin and resulting some deficiency heat. So they have strong attachment with dry heat. But for people suffering cold or cool dryness in autumn dryness warms conditions there, they may have initial cold attack or cold dryness attack, but usually they have internal yang or qi insufficient. That's why they have much more attachment or easy to mingle with yin types of nature, such as cold dryness in a specific season, especially if it's windy weather. So cold dryness can affect people have insufficient qi or yang internally. And pulses will show more tightness involved, even they're floating, more cold involved regarding tongue presentations that happen in later autumn. So these are basic progressions of warm dryness in autumn. So warm dryness due to both are yang in nature, so warm and dry, both are yang in nature, easy to injure the lung fluid, because lung prefer warm and moist environment. If both double yang pathogen affected, and through the cough, through the sore throat, very easy causing fluid and body injury, resulting dry heat. If the dry heat can be resolved, everything will be fine. If the dry heat further transmit internally, can cause possible constipations, which is a common concern. And more severe, if your bodies have much more strong yang qi, and this kind of dry heat can cause more severe conditions internally, and usually related with constitution conditions. So they can damage the nutritive yin and the qi, kidney, and liver yin. It's not very common progressions, but could happen for some very, very few conditions. I identify the factors. The autumn is a season usually shows the yang qi start to descending, and that's why you can see all the leaves, lack of nourishment. A lot of leaves is going to drop or turn the color, and then eventually will be drop. All the nutrients for the tree go to the branches and eventually go to the trunk and go to the root. Same for the human being. All of our circulated yang qi surface is going to descend inwards into the organs. You're very easy suffering dryness on your skin, very easy have a dandruff for your scalp, so for the bodies. So that's why dryness comes out due to seasonal changes or yang qi change for the year. And lung is specific organs corresponding to the metal of the season autumn, and as well as the wheel level or lung systems, which is very easy have disorder if during the autumn have external pathogenic attack. So any kind of lung disorder and wheel level disorder will come through as kind of clinical manifestations. Due to dryness of natures of autumn, when the lung has become disordered, injury or body fluid injury could happen in very early stage. So if this kind of windworms comes in the same season, because windworms can come all year around, especially in the spring and winter. But if the windworms happen in autumn, and they usually will combine with more dryness conditions. So if the dryness comes out and also have very severe temperatures comes up, we do not call that simple autumn dryness worms. Instead, we call the windworms. Sometimes maybe just confuse these two together. Based on clinical differential diagnosis, we just treat it accordingly, resolve the wind and heat, and also to manage the dryness, supply the yin. If the lurking some heat happen in the autumn, and they are not just have some heat rise up triggered by external dryness passage externally, they also have internal dampness and internal incubated damp and heat, both dominant and more severe and fast transmission. And usually clinical manifestations are much more serious than the autumn dryness worms. So this is easy to differentiate difference. Now, the treatment principle for autumn dryness worms is dryness have to be treated by applying moistened natures. So while we recommend drinking sufficient liquid and also using herbs have moisture in nature, they help to release the dry and worms from surface at the same time without damage body fluid. So early stage, using cool dryness method to manage using aromatic cooling in nature to resolve dry worms. Using aromatic gentle worms to deal with the cool dryness in later autumn. So these are opposite natures of herbs dealing with opposite dryness for the autumn dryness. But no matter which dryness deal with, you have to what? Maintain good moisture or enhance supplies body yin and body fluid. That's a principle. Triple burner concept is not very commonly applied for the dryness condition concern. Triple Sand-Gel differential diagnosis mainly dealing with the dampness involved associated with qi dynamic disorder. But if we really want to divide it and different, part of the burner, up, middle, and the lower burner, here just tells us what organs we need to focus on in order to construct proper herbs in the formula. So if it's mainly representing up respiratory concern during the dry autumn dryness suffering, you need help look after the lung by decimated lung with pungent, cooling, and sweet herbs to expel the pathogens and at the same time supply the yin. If the mainly shows thirsty, so that means dry heat has been formed due to unresolved and autumn dry worms in the surface, went to the internally into Yangming regions, into qi levels, and you need to have more sweet, cool herbs to help supply the yin and to supporting stomach and the lung organs yin. And if the lower burner presented major, so such as the liver and kidney yin or blood has been affected, these are usually related with people who have very severe constitutional indeficiency with a lot of hyperactive heat. So people usually look very skinny, hyperactive personality, and very easy feel hot, very easy feel anxious, a lot of heating. The tongue is very pointing, very red. Once have been affected by dry worms passaging in autumn, they very easily shows dehydrations or further yin and jing damage in both liver and kidney, and then we need to apply some sweet, salty, and cooling ingredients to help supply relevant organs accordingly while we're treating dryness pathogens. So here just tells us how to, based on the different locations, different organs, to construct proper formulas, proper herbs into the final formula. Okay, now any questions for this kind of first introductions for the autumn dryness? All right. Autumn dryness worms is very, very simple category of wenbing. So you can see all the basic introductions at the first part of PPT is very, very brief, nothing complicated. Here comes the common pattern. When we're talking about a pattern for teaching purpose, here talking about most common pattern presented or relate with certain category of human being does not mean they are not going to have different pattern based on individual suffering. And here just using this kind of example to help us understanding how to go through differential diagnosis, what the common pattern could happen in relate with relevant pathogens in that season based on this category of human being. So first example, dry heat in autumn can affect the lung, especially initially affect the lung system superficially or V level and causing relevant body fluid or injury for the lung simultaneously. So you can see here all this dehydration complaint, dry skin, dry nose, dry lips, and even non-productive cough and thirst all comes out. At the same time, have external condition, chills and fever. But fever is predominant, more dominant than the chills. So it tells you heat is dominated due to nature of dry and heat nature, both are yang in nature. And slightly sweating, but heat pathogen cannot be resolved. So you see the tongue also redness with white tongue coating. Red tells you heat has been go to which level? Which level? You are going to have redness on the tongue body. Qi level. Thank you very much. So this typical dryness presented here is not in V level at all. It's already go to some level of Qi level. The typical conditions is thirsty. We are at both. So redness of the tongue here did not mention this lung organ or system separately. Here mentioned lungs, here mean internally and externally here. So both together. And by checking the symptoms and then can prove thirsty typical Qi level have a heat. With color of the tongue as heat go to Qi level. But with coating, which level involved? Coating here. White coat is V level. So here tells more clearly. That's why in Wenbin, tongue differential diagnosis is very important. They involve both Qi level heat and V level cold. And floating rapid pulse is combination. They have superficial, have a heat, and also have internal conditions. If a tongue coating tells a yellow, definitely yellow, so that means internal heat is more dominant than external attack. So using gentle dispersing pathogenic dry heat formula for resolving and heat in the lung and superficial level. So Sang Ju Yin is the choices here. Or using Sang Xing Tang. Sang Ju Yin mainly deal with the V level wind heat. And some ingredients can help avoiding dehydration, such as Lu Gen. But the Sang Xing Tang is more suitable. Both exterior and interior has been involved dryness in autumn dryness season. So they have Sang Ye, Xing Ren to descending lung qi, expel the superficial attack, and lubricate the lung by using Xing Ren. Zi Zhi clear the heat. Sa Shen nourish yin of the lung internally. Dan Dou Chi clear the heat through urinations. So one is clear the heat through urinations. Sang Ye clear the heat through gentle perspirations. And with additional Bei Mu was supporting Xing Ren to dealing with a cough related with unproductive cough. Li Pi was supporting altogether, supply the yin, and also help manage the cough related with dryness as well. So Sang Xing Tang is very commonly used formula to deal with autumn dryness worms due to dry heat or dry warm pathogen cause of conditions. They have mixed internal and external dryness in the lung organ and superficial V level conditions there. It's a bit funny things is when the lung become dry, it's very difficult to differentiate is a superficial dryness in the channel or organ dryness, because once you have dried cough, you are not able to have productive cough, usually always related with the thirst. Once a non-productive cough whistles together, you're always with rapid pulse and red tongue body. Even they're not red all over the tongue, but you can see while you're red on the tip and edge, you have a lot of multiple cracks on the frontal part, middle part of the tongue body, which tells you severe body fluid injury and due to severity of the heat. Because if the dryness aren't in the surface, they're not causing serious dehydration, present as the cracks on the tongue, or causing thirsty for the human beings. Now, any questions for these slides? Or for the information presented in these slides? Okay, let's have a look at the next one. And cool dryness attack the lung. So here you can see differently. Cool is in nature, dryness is young in nature. Have a look at the clinical manifestations. So they order the presented conditions changed. They put the fever and chill, aversion to cold first. The typical 太阳 disorder or wee level disorder. At the same time, cold related with headaches and nose sweating. So it looks like this is a 麻黄汤 syndrome, isn't it? But because it happened in autumn, at the same time, they have dryness nose and dried in the throat and dried in the mouth and the lips. So all these dryness, some level, not very severe, some level of thirsty also can present it here as the whole lung organs, lung systems have insufficient lubrications. Or cough with white and frothy foamy sputum. Okay, this is very interesting one. In the clinic, we all know previous concern dryness, very easy to understand. But some people tells you, or some people when they check their tongue is so wide, greasy. At the same time, they tells you, when I'm cough, I never can help and effectively to expect the mucuses out. Occasionally comes some white, very frothy and sputum, or very sticky, frothy, foamy sputum. This is a typical dehydration in the lung organ and related to some level of dampness, possible dampness involved if the tongue coating is very greasy. If the tongue coating shows dehydrations, this shows you just level of body fluid has become insufficient. The body is struggling and generate these kind of secretions from mucous membranes. So do keep this one in your mind if you never ever aware this is related with dehydrations. Because these part of dehydrations, we know that for many, many years. So this thirsty, dry this, dry that. Dry this indicated dehydration. But this is also very important, clinically indicated dehydration. So do keep that in your mind. And disperse the lung qi to help release exterior and at the same time help improving expectorant of the mucus. So transform the flame. Here using 杏苏散. 杏苏散 here is composed by 杏仁、紫苏叶、前胡、桔梗、止咳、陈皮、茯苓、半夏、生姜、大枣 and 甘草. So by checking the formula, you can see they are modified what formula? Thank you very much. Now, because they have foamy sputum, there's some level of damp, yes? But here did not mention any kind of dampness, only mentioned cold and dry. So because there's coldness here, the lung does not like it. Coldness, very easy what? Make the umbrella not able to expanding up. Lung prefer warm and moist environment. They're not just dehydrated, they're also very, very cold, causing constraint. So dampness can come through. Usually cool dryness pathogen very easy affect people have insufficient qi or yang. So that's why using this formula, you can see there's combination of tang, transform the damp, regulate the qi, with other herbs to disperse the liver, disperse the lung qi, manage the cough, and without damage body fluid. So there's a very good and composition for this one. Now there's a questions here. What about the tongue and the pulse here? So how do you think what will be possible tongue and pulses here? So pulse will be floating and tight because there's headaches, yes? So possible floating under the pulses. Floating is due to superficial, tight due to cold, and possible wiry combination due to this kind of cough, as well as dehydration involved. Tongue with this kind of cough, either with this combination of both of this cough and dryness, could be dehydrated tongue, but with white tongue coat. And tongue color will never ever be very, very bright red compared with previous pattern. Thank you. Now, any more questions for this information presented here? Tongue coating either white thick, and still you can see the cracks in between the thickness tongue coating, or no thick tongue coat, but it's white color and with multiple cracks in the frontal part, because due to a lot of dehydrations here. But tongue body should not be very, very red due to they only have little bit cyst, not very severe cyst, but headaches and severe chills, aversion to cold is more dominated. Yes, they should not be yellow. It has to be white, either white thin or white thickness. If the white thickness, that means internal damp coat is more dominated. So this depends on pre-information. If we're understanding, for any kind of cold dryness, if they affect the body, they must have what kind of constitutions of person? Is yang dominated or yang deficiency dominated? So yang deficiency is the dominant. Good. So if you have a precursor of yang deficiency, even here does not mention any yang deficiency here, and you should be understanding under this kind of statement, they have possible weak internal yang qi, weak functionalities in Middle Earth, and possible weak lung qi as a kind of precursor. You definitely is possible what? Possible greasy tongue coating, possible weak pulses is possibilities internally. Thank you. So tongue coating will be white is more common. Good. We can discuss some issues, make it much more clearly. Next slide is talking about dysfunction of up orifice due to the attack of dry heat. This mainly focusing on people have tinnitus, dry mouth, sore throat, and that's not talking about something like unconsciousness or comas involved. So here something different. So this orifice talking about orifice about the ear, nose, or throat, etc. So no chills, only fever, red eyes, so another orifice, so only fever and red eyes. So this is one of the orifice involved, eyes. Dryness can cause a lot of allergies for the eyes if you don't have sufficient tearing. Tinnitus with the ear, dry mouth, mouth again, sore throat, so throat, and swollen gum, so they're still inside of the mouth. So this shows a lot of what? A lot of heat involved in up orifice due to dry heat. So body have what kind of constitutions? The dry heat can attack in the body. Have a sufficient yin or sufficient yang, or insufficient yin or insufficient yang. Have yin deficiency, good. Have insufficient yin and dry heat and can affect. That's why the body very easy suffering tinnitus, dried mouth, and sore throat or swollen gums, because sufficient saliva, very good natural antibiotics and natural secretions to help maintain good balance of flora. So if you feel so dehydrated, very easy have infection for the gums, for the throat as well. So dryness and burning of nasal passages, so another part of dryness involved. And red tongue body, dry, thin, and yellow coat. So they all matched with constitution for the tongue of the pulse. Yes. So in dehydrated constitutions, you're going to very red, pointing tongue, very dehydrating tongue coating, and rapid pulses, and very anxious personality, and very fast moving, faster speech as well. So for the treatment, based on clinical manifestations and possible constitution, you are going to manage this kind of heat or fire, and also manage dry heat in a specific upper jaw orifice. So here using 壳和汤, 壳 is a 黏壳, 薄荷 as a chief ingredients. So 薄荷 is very good one to clear the heat without damaged body fluid, because they're very cooling and very gentle herbs. They can also moisture in nature. They can dealing with redness in the eyes, can dealing with thirsty, dry in the mouth, and discomfort for the throat, and good also soothing for the gums, and very soothing for the nasal region. Lianqiao is a combination bitter, cold, salty, so this can help clear the heat, soften hardness, and without damaging because it's salty. And Sanzhi pi, so this is the peel of the gardenia seeds. And Jiegen, Mangbing skin, and Gancao. So they're all very, very gentle herbs, not extremely bitter, cold, dry. They can clear the heat at the same time, protect the body fluid, also enhance expectorant. This help enhance expectorant and clear throat discomfort, together with Gancao, manage the sore throat. And this skin of the Mangbing skins and have diuretic. The medicinal values for the Mangbing is from the skin. So here, removed all the starch. Only using skin means using more concentrated of Mangbings, and clear toxicity, also diuretic in nature, leading everything downwards without damaged body fluid. So everything choosing very, very gentle and very, very easy to approach and minimize possible further dehydrations. So this is Qiao He Tang. You may do not have a chance using this kind of formula, but you can using the idea of this kind of formula. So you can using if it's organic fruit, you can the peel of the pear and get Mangbing's green part of Mangbing structures, and get lots of the green vegetable, not green, a lot of beans surface of the structure, and or even like get a green fruit, getting peels and make a tea to drink. They can help you clear the heat. Or if it's in summer, it just get watermelon peels. Very good. Clean it properly and then make a brew, make decoction and drink the liquid. Very good, help clear the heat. Next pattern, talking about lung in and fluid injury caused by the dry heat. So why the dry heat can comes out? That means either body have what? Insufficient yin and attractive dry heat. If the dry heat has not been resolved in the surface, they can go to the organ internally and cause more severe lung organs yin injury. So here is much more severe conditions and more organs involved in lung, and by this kind and strong strains of double yang pathogen, dry and heat attack. So they still have a fever, but there's no chills. That means no superficial conditions. At the same time, that shows irritability and thirst. This is a typical qi level, have a heat. Severe cough with little flame, that means lung qi, this TD function has been affected. So organ also be involved, as was wheezing, shortness breathing, that's getting more severe. Distension, chest pain, so this tells the organ dysfunction has been affected. And slightly red or red on the tip, depends how much of strength of the heat involved, so how severe level of heat will be affected. If it's only in qi level, they can present only on the tongue tip on the edge. If the whole tongue body is so red, I mean whole body has shows previous severe yin deficiency with hyperactive heat, or strength of dry heat so severe. And pulse is rapid and slightly thin and weak. So this thin and weak pulse indicated have insufficient body fluid, and weak indicated possible qi has also been affected. Rapid indicated heat. Lung is a very interesting and very tender, delicate organs. Once the heat affects the lung, they're not just causing body fluid deficiency. Very easy why the body fluid deficiency causing and qi also damage at the same time, because when they have insufficient body fluid, they are not able to carry on the qi to the lung. So you can find clinically when people suffering chronic dry cough for quite a while, they always looks very, very tired, looks or complaining, exhausting or fatigue. So here, based on these conditions, we're using the very gentle using herbs to clear the heat, disperse the dry heat in the lung organ, and also moist and the dryness supply the lung yin and supporting the lung qi, and restore the lungs DD functions as well. So help the lungs dispersing, descending at the same time, and enhance body fluid and help lubricate it. So using combination 石膏 and 桑叶, one is release the heat from surface such as 桑叶 to help to expanding out. 石膏 help expanding out at the same time, clear it and vent it to the surface, clear the heat. So 石膏 is aromatic, pungent and cool, so which can clear the heat without damaging. So pungent, cool and sweet. So this is a very good combination. And combined together with 人参 and 甘草 supply the qi, 黑芝麻阿胶 supply the yin, with together of 麦冬, 杏仁 was supporting 桑叶 to descending lung qi to restore the lungs DD functions. 枇杷叶 was supporting both of these 杏仁 and 桑叶 to clear the heat and restore lungs DD functions. So this is a very good combination. This is also very, very popular, famous formula used to resolve dried heat affect the lung, cause abnormal lungs DD functions with both body fluid injury and qi injury. And this formula, more commonly used in Melbourne, used for people after chemo or radiotherapy. So they may do not have lung issues initially, but after receiving chemo radiotherapy, and they're suffering dehydration with dried cough. Shows a lot of injuries related with chemicals and through the treatment that they received. So this is good one to help them restore the proper lung functions by using these formulas as well. Of course, still need based on the differential diagnosis. If they show typical dried heat in the lung with both lung yin and the qi deficiency, this is a very good formula, and it's also very pleasant. The taste of this formula very, very good. And next formulas here, or next pattern is talking about injury to the fluid of the lung and the stomach both. So that means go to qi levels and by the dried heat. If the dry heat or warm dryness in autumn cannot be resolved in a superficial level, turned into more severe dried heat, and they affect the lung and also keep going, they can affect both the lung and the qi in the qi level. So in this way, they can show something similar like a big four, but slightly different. Have a look. What's the difference here? So they have very severe dry cough, similar like whooping coughs. Very, very thirsty. Due to such severe intensive cough, they have very, very thirsty. It's quite similar like whooping cough. Children suffering from this one. And they only can easily drinking the cold liquid, a cold beverage. They cannot bearing any kind of warm drinks because they're already so hot through this kind of intensive and cough. Looks like everything spasm comes through. And they have very, very dried mouths and the tongue and slightly fever. Initially, if the body fluid has not affected intestine, there's no constipations involved yet. So that is lucky one. If the constipation involved, and much more harder to resolve this kind of dried cough. Thank you for the question, Helen. Excuse me. Now, this dried mouth and the dried tongue indicated the dryness or heat has been damaged body fluid so severely with slightly fever, and it tells you in some level they may do not relate with serious infections and just relate with something else that's unresolved. So whooping cough is typical conditions can match with this kind of suffering for children. They just cough, 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 cough. Looks like the whole stomach what comes out when they cough, but nothing actually can release out. All this kind of dried cough, you can hear the echo even in their lung. X-ray shows no mucuses in their lung organs, but they're extremely thirsty. Nothing helps them quench the thirst. If they still can open their bowel regularly, it's very lucky. If they also have such trouble suffering constipation, this cough even worse. So supplies body fluid or enrich the body's yin is very essential to supporting both lung and stomach functions. So here using 沙参麦冬汤 plus 五子一麦门冬五子一 I forgot this one. That's such a pity. 五子一 I forgot what's this one. So we know 麦门冬汤 is quite a commonly used formula to supply the yin for both lung and stomachs, clear the heat. Yes, with additional 五子一 raw or fresh juice. 五子一 Oh, I need to check it for this one. And 麦门冬芦根 and pear, and this is the water chestnut, 荸荠 water chestnut, and 藕节 joint of lotus root. So the overall, this is a very delicious, very, very nice one. And most of this kind of dry heat suffering in the early autumn, or some people could have whooping coughs in the later summer as well. But most of usually it's near the end of the summer and autumn started, and you still have this kind of vegetable or fruit sold in the market. So this is a very good one. Get a fresh drink made from this kind of fruit. So that's just water chestnut and lotus root. You can make very nice juice, even as a sugar cane juice. You make very nice juice from this one, combined together with radish juice. It's good to help enhance expectorant and also help quench the thirst. Very, very yummy one. Very nice one. And overall, it's very, very delicious one. And you need make the patient to have something lubricated throat constantly. Or you can apply together with honey and grapefruit juice, make very nice tea, soothing, add with mint. They have to use mint to clear the heat. If you have allergies with grapefruit, you cannot use it. Otherwise, you use grapefruit juice, excellent, with honey, add together with mint, a very good one to soothing the throat. Very, very nice. Gualo, you can use the whole fruit of gualo. You can use that one. Whole fruit of gualo can help lubricate the bowel, lubricate the lung, help enhance expectorant. Also very good one. Or using pieces, peel of the gualo pea. Peel of the gualo pea is much more sweet than whole pieces. But if they have constipation, using whole fruit of gualo, very, very good one. Any cautions for kids with whooping cough? This question is, when people suffering whooping coughs, especially children, and they will recommend them have a big drink at once, very easy causing choke. Give them a little bit lipid lubrications and slowly, and also calming, little bit and treatment on the body, calming the body is very essential, because more they're anxious, more agitating, more cough. And when kids suffering whooping cough, they have lots of fear for them, because when suffering a severe cough, they feel they could not breathing, they're going to suffocate to death. So calming is very essential. At the same time, the recommended lubricated drink, especially food-related, diet-related drinks to help them, to help manage the spasm for the cause of a cough and also manage the symptoms at the same times. Whooping cough, you can do, have you done the 四缝, doing the, not bloodletting, get the liquid, clear liquid comes out, lymphatic liquid comes out from 四缝 on the fingers of all the hands. Have we done that one for the clinical practice for ourselves? This is a very good one in a way to help manage this kind of anxious, help improve lymphatic drainage. Okay, so if one day we can meet in the clinic, we can recommend you to practice on yourself. It's good for children. It's a good way. Even they do not suffering malnutrition. For people suffering whooping cough, it's a good one to stimulate it functionalities of the earth and then indirectly supporting the lung. Okay, that's good. When we done that one in our unit practice, it's very, very interesting, because if you can encourage lymphatic drainage, especially practice 四缝 on the fingers of the hands, and this clear liquid comes out, next visit you can see the improvement for the digestion, improvement for the cough. Just so clear, very, very simple one. You don't need a lot of drugs, medications involved. But not for everybody, but it's good help for some of the children when have suffering very, very bad cough, at the same time as poor digestion. Most kids, when suffering whooping cough, and they always have underlying poor digestion. So this is correlated. When you learn the pediatrics, you know when children have poor digestion, they're inclined to have lung disorder suffering at the same time. So it's good to practice that kind of points stimulations for children. So we are going to demonstrate that if we see each other in the clinic. Or you can ask your clinical supervisor practice in the clinic sessions to do that as well. 瓜蒌贝母散 is good for this pattern. 瓜蒌贝母散 can be used for dried cough, but 瓜蒌贝母散 are not used for people who have extremely thirsty. When they have extremely thirsty, they have more severe and indeficiency, have unresolved heat trapped. 瓜母贝母桂母散 much more gentler to deal with just dried cough itself. They don't have serious thirst. It's a very good question. Thank you. It's a very good one. And this kind of specific 沙参麦冬汤, they can supply the yin, also clear the heat. Same with additional other edible dietary ingredients. We recommend it in the autumn season. It can also supply the yin and clear the heat. 瓜母贝楼散 is a powdered formula, which is good to help improve expectorant, help the mucus comes out, manage dried cough. Taken for mild conditions, but when you have a severe dried cough, very, very thirsty, you need something to supply the yin and clear the heat, as well as manage dried cough. Thank you. So this is white fungi, image of white fungi. When you see these products, see slightly yellowish after they dried, slightly dehydrated. That's why color changed. And these big pieces, you can cook it for a few different times. They can expand it in the water. These are very, very good products. Can manage the dried cough when cooked together with the pear. And they can supply the yin or cook together with rice. It's a very good one. And they do not have a strong ability to clear the heat. They mainly supply the yin, quench the thirsty. And when any kind of young or old people that feel extremely yin deficient in the lung, there's a good supplementary dishes you can make a very nice slow cooking one. And the flavor is different if you cook it on a pressure cooker or cook it on top of stove. If you cook it on top of stove, you can have very nice, sticky, very good colorless products. When cooked under the heavy pressure cooker, and not very tempting products at the end, but maybe the chemical component is the same, just not very, very tempting. It looks very, very ugly in the presentations. You can bring that one in your backyard. If you have very good big backyard, you just need to get proper fungi seeds from the special supplier. You can bring these products. I find some products, programs in the YouTubes, a lot of the fungi production training in China or maybe here locally, and teaching them how to produce the edible fungi products in their backyard. It's very, very interesting courses you can explore if you are interested. Now, any questions so far? We may go and have a 15 minutes break and come